Hi, I'm Dr. Chandresh. I'm a psychiatrist. I work here at ANC Gachibowli. Today, I was thinking of addressing a frequently asked question. What does a psychiatrist do? Who are we? So, a psychiatrist is somebody who has gone through medical college, you get an MBBS, and then you do a postgraduate degree in psychiatry. So, the mental picture that you may get of a psychiatrist is somebody who is working in an asylum in an inpatient setting, dealing with people who are quite aggressive or something, mostly based on depictions in movies and TV shows. But that isn't really true for most of us. Our roles depend on the setting we work on. Quite a few of us work in an outpatient setting where it is a clinic similar to any other medical clinic that you have, and you walk in, you have a discussion, we evaluate you, we see if you have a diagnosable condition and whether that can be treated. And during this diagnosis process, you can have certain questions which are being asked to you, either in a form of an interview in general or more specifically in a form of a rating scale or any structured assessments. And for treatment, it can be either medicines, just as any other medical clinic that you may get. You get a prescription, you take the medicine, you come back after a few days to review with the doctor, and then this goes on until you feel or the doctor feels, and then there's a mutual agreement on when to reduce and stop the medicine, just as any other medical clinic. Another way doctors, psychiatrists treat their patients is something called psychotherapy or talk therapy. Psychotherapy is not just going to somebody and venting to them about your problems and talking about it, though that does help, though that does produce some emotional relief. To produce long-term changes, this is not sufficient. So psychotherapies are often structured. They go on for weeks to months. Usually you meet a psychiatrist once a week for these therapy sessions. And these therapies are of different schools of thought. There's a cognitive behavioral therapy, there is long-term psychodynamic therapy, there is therapies based on mindfulness, mentalization, there is DBT, and not everyone is or can be an expert in all of these different schools of treatment. Some of us may prefer cognitive behavioral schools, some of us may prefer existential schools, some of us may do long-term psychodynamic therapy. So it really depends upon your specific mental health provider. And of course, these roles that we play change depending upon the setting. In an inpatient setting, we may be seeing patients who are more severely ill. So we may see patients in an ICU, we may be seeing patients in a medical or a surgical ward, patients in a transplant setting, patients who are undergoing chemo, or patients who are at their end of their life, they're undergoing palliative care and they require psychiatric help. Another view that people may have of psychiatrists is, again based on movies, is somebody lying on the couch, psychiatrist or somebody is sitting on the other side writing down things without speaking. This is a form of psychotherapy called psychoanalysis. So psychoanalysis is a type of psychotherapy that a few people are trained to do, but it is not the only thing that we do. Another misconception, again from popular media, may be of a psychiatrist dealing with patients who are very aggressive or unpredictable. Again, there's a misconception. Not everybody who comes into a psychiatric clinic or in a psychiatry setting is unpredictable and aggressive. That is a minority of people. The vast majority of patients that we see in an outpatient setting are not aggressive, they are not violent. There is no fear that you come to a psychiatric clinic, you will be subjected to certain environments or situations like this. Most of the people that we see in an outpatient setting, especially here at ANC, are patients with depression, anxiety and OCD. Another misconception people may have is once you go to a psychiatrist, all you will get is sedatives, medication to put you to sleep, and you will have to take these for the rest of your life. That is not the case at all. For depression, if you have, for the first time you have an episode of depression, medicines usually go for 6 to 9 months. If you're having a second episode, maybe up to 2 years. And if you have an anxiety disorder, again with a mix of medication and therapy, you may have to take it for a year or so. For OCD, it is not a lifelong of treatment. People with OCD have ups and downs. Certain times of their life, they may have symptoms of OCD increase. Maybe it's a stressful situation, job loss, death of a family member, graduations, big exams. And it is not that these symptoms will continue to be at the same level throughout their life. These symptoms do subside with medication or sometimes even on their own, but then there is a chance that these symptoms may arise during certain lifetimes. Then again, there are certain conditions like schizophrenia and bipolar disorder which may require medication for many years and possibly at times in select patients for their entire life. In these cases, it is similar to diabetes or hypertension, but similar to how you wouldn't call a person with diabetes that they are being addicted or they are developing an addiction for their medicines, or you wouldn't say somebody with hypertension to be addicted to their BP medicines. These do not produce addiction. These are medicines to resolve certain symptoms and to help the person lead a better life. So I hope you found this video insightful. I hope I have sort of cleared some of the misconceptions you may have of what psychiatrists do and what treatment for psychiatric conditions entail. If you have more questions, you can let us know on our social media pages, and you can always come down to one of our clinics if you wanted a detailed evaluation and management for any conditions that you think you may need help with.